Hi folks, I'm Tuckey-Larus. I'm a physician here at Virginia Physicians for Women. I practice mainly at the Johnston Willis location. What we're going to do is talk about sexually transmitted diseases. That's a very interesting and complicated aspect of GYN. And there's some baseline stuff that we do for our patients. We try to ask them, we try to engage them in their health care, but we thought this little video would help have everyone understand a little bit maybe about what they should ask and what they should appreciate is going to happen at their exam. Well, an STD is a sexually transmitted disease, meaning it's transmitted by sexual intercourse or sexual contact. And of course, let me elaborate a little. Sexual contact can include genital, oral, and anal exposure. So any sexual contact would be could be the source of a sexually transmitted disease. Surprisingly, there are symptoms that are actually not very obvious. Mostly, if we were going to look for some, we might have discomfort, pain on urination, a funny odd discharge, even a discharge with an odor. We could have open sores or open lesions. We could have ulcerations. We could have fevers, chills, a variety of things, and of course some of these things would be more further complication of the problem, but certainly most of the most common sexually transmitted diseases actually don't have a lot of symptoms and should be screened for at an annual exam. There is a very good possibility, as I had alluded to before, that you might not know. And this just basically reinforces the idea that she should go and get seen at least yearly by your gynecologist or your primary care. There are some people that will have symptomatologies, as I alluded to before, where there's a manifestation of the problem, whether it be a very odd discharge or some of the more involved diseases such as ulcerations or sores. Well, we're going to go back to the way old traditional values, and the best way is not to have sex, and of course that's the only absolute and abstinence. If one is to engage in intercourse, I think that one has to take into account who they're involved with, where they have been, some of their habits. I mean, obviously IV drug users, people who engage with multiple partners are going to have a higher risk of carrying a disease. And of course, the proper use of condoms, which unfortunately, a lot of women are not educated in using condoms correctly. And then there is the female condom, which is actually even better than the male condom because it covers the entire genitalia. And the use of it is probably not as much predicated on a person's ability to know how to use a male condom. The female condom is more of a picnic blanket. Going back to what I've alluded to, the use of condoms in the proper in a proper way are effective. However, there's just a lot of misuse and misunderstanding of how the condom is supposed to be used, and inadequate and inappropriate use leads to the exposure of to the STD. The other thing is, I think that a lot of people don't use it regularly, and they say they do because they think if they use it 4 out of 5 times, that's good, but it could be that 5th time.